I think most stories, if you look at most people, physicians, kind of like any other job, I think your profession chooses you. So I wanted to be in medicine. I chose physical medicine and rehabilitation, PM&R, because it's physical medicine. Just like the name sounds, you rehabilitate people who have dealt with anything from stroke to head injury to the like. And I always lean towards the sports medicine aspect because I was athletic growing up. Gymnastics, 40 years of martial arts, and well, so like anybody else, I started getting injuries. And I was super healthy until about my mid-30s, and I was in my fellowship, and my knee started bugging. I wasn't satisfied with the answers I was getting and the treatment plans. Therapy wasn't helping, and they said, well, let's get an MRI of your knee. I said, well, I don't think anything's wrong with my knee. I knew enough about medicine to say that, it's not a big mechanical issue. And, it's about $1,000. When you're a poor resident, you really can't afford that. He said, well, we should see what's going on. Let's get a steroid shot. I'm like, I know steroids. So I started to realize that there was not a really, pain management was not that effective. And most pain doctors will tell you that. Our success rate is just not great. And I, by chance, got a copy of a book. My dad, who was a phenomenal physician, gave it to me, called Prolo Your Pain Away by Dr. Ross Hauser. And, Ross is a guru in regenerative medicine. And I'm lucky to call him a friend now. And I happened to send a patient of his when I was working in Indiana, a patient of mine to him. It was a big guy. He was an ENT who'd hurt his back, and, the steroid shots weren't working. I said, are you willing to drive 90 miles to Chicago? This might help you. He had phenomenal results. So I took my first conference 8 or 9 years ago, and it was like a religious experience. I got my knees injected, and I realized I was just going down the wrong path. There's a much healthier way to do this with the evidence-based medicine that will get you healthy.
Wow. So your knees were bugging you.
Oh, yeah. Yeah, my knees were bad, and my back would give me trouble. I'd been martial arts since the age of 9. I was a college gymnast. I was a varsity cheerleader, which I always joke, it's like powerlifting, stunting, and tumbling while you're smiling. And it takes its toll after a while. And it's amazing. My knees at 50 are better than they were at 40.